Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and where are we taking calls right now, Dr. Darrow?
The phone number to speak to Dr. Darrow, hey, that's me, is 866-870-5752. That's 866-870-5752. I would love to talk to you. If you want to get a hold of me at the studio, not the studio, that is the studio, at my office, the number there is 800-300-9300, 800-300-9300. And there are people by the phones there. If we don't answer your questions on the live radio, call me there. To get to the website, to email me, and to watch videos, you can go to www.lastemcells.com, www.lastemcells.com, for a free copy of my book, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm so proud of that. There is a foreword by Suzanne Summers, a great proponent of what's called alternative medicine, which is really just natural medicine. There's nothing alternative about it. You get a free copy of the book if you call me now, live on the radio at the studio, 866-870-5752. This book took me 5 years to write, to get all the research that's in it. We've got 250 or so studies, a little bit more than that, and everything you want to know about how to save yourself from getting an orthopedic surgery and healing with just some simple injections of platelets and stem cells. Also, I wanted to mention in the office, we do something that's called the vampire facelift. It's the same thing as what I do on the body to get rid of musculoskeletal pain, but it's done on the face to regrow the cartilage, not cartilage, that's for the joints, the collagen, which actually is a major constituent of cartilage, to regrow the collagen in the face and make your face look young again. Also, these procedures can be done on the head if your hair is thinning, to stimulate hair growth, to wake up those follicles that are dying. Nita, I heard you breathe, so you might have had something else you wanted to say.
Yeah, I do want us to talk to Eric in Hollywood. What do you think?
I would love it. Eric, how are you? Dr. Marc Darrow.
Fine, thank you. Appreciate being able to call in. I know you fielded this call before. I've had a surgery on my left knee, the medial meniscus. About a third of it's been removed. I went over to a local place, Curlin Job, you know it.
Yeah.
And I wanted to know if you could, you've had this call before, but I'd like to know if you could help it be more stable. I'm a bodybuilder, and things I can't do anymore, leg extensions, etc. It just hurts for days after, and it's never really been right, but it was better at the time to get the surgery. It was some years ago, but I just want to know if we can get better on that.
Well, again, there's no promise of anything in medicine. I have to examine you first, Eric, and see if there's laxity. Sometimes the medial collateral ligament, lateral collateral ligament, or the anterior cruciate ligament or posterior cruciate ligament, things like that can be distended or irritable, and they may be torn, who knows. So I'd have to do an examination. I don't personally care about you getting another image, because my examination is I think, a lot better in finding the problem than getting an MRI. Although I do have people who come in and they go, you don't like MRIs. And I go, no, it's not that I don't like them. I do like them. It's a good adjunct to an examination, but it should never be the reason to do a surgery, okay? Unless there's something that's horrific going on, but that's not most of what I end up seeing. That's stuff that ends up in the emergency room. I get people who are typically down the road a little bit with their injuries. I do get some acute injury. By the way, acute means new and chronic means old. A lot of times I'll get ACL ruptures where a knee is all swollen. A person comes in and says, I went to an orthopedic surgeon. They want to do a surgery immediately and give me a graft from my patellar tendon or my hamstring or cadaver to replace the torn ACL, anterior cruciate ligament. And I examine the knee, and it's fine. And you can have a anterior cruciate ligament, for example, that's torn and have a very stable knee. So there's a lot of different elements that I have to look at if I am going to give you information, Eric, about your knee. And the only way I can do that is by examining it. So with acute injuries like that, where the knee swells, the most important thing to do is use the ultrasound, which I do on knees, to look inside and take fluid out. And that could be a reason why your knee feels unstable. You can have an effusion, or what we call fluid inside of the knee. And once we take that out, often it can stabilize. Now, when you take an effusion out, if you don't treat the knee with regenerative medicines, platelets and stem cells, the fluid will often just come back again. So it wasn't a real viable decision to go ahead and just aspirate. I know a lot of doctors just aspirate and leave it or put a steroid in, which is the worst thing you can do, because the steroid, like cortisone, softens the cartilage and then destroys it long term. So please don't ever get a steroid shot for your knee if you can help it. That's just not a great thing to do. I've had people who have come in after multiple steroid shots, cortisone shots, where there's basically no cartilage left, where the doctor has destroyed that joint or that tendon. And that's what we call iatrogenic, when there's a problem, medical problem that happens because of the doctor or the medicine or being in a hospital where there's infections and things like that. And the number 3 cause of death in our country is actually iatrogenic reasons. It doesn't mean the doctor did something wrong. It's just that the medical culture is wrong. Do you understand? The doctor's following the rules that are presented to him, but those rules need to be changed. And that's part of the forefront of what I've been doing the last 25 years or so with regenerative medicine. It goes against the grain of the culture of medicine. It goes against orthopedic surgery, which is there to operate in most cases when there's an issue. And I love the surgeons. They do the hardest work in medicine. Don't get me wrong. I love orthopedic surgeons. I don't like most of the surgeries they do. Okay, I see way too many people that have neck and back surgeries, knee surgeries, hip replacements, shoulder replacements, where it didn't work out. So I know there are cases where it does work out. I'm not saying all of these are terrible things. It's a gamble. And if you have an opportunity to heal with an injection, using what we call regenerative medicine, your platelets, stem cells, why wouldn't you just walk in, get an injection, and walk out and heal, rather than go under the knife and not know what's going to happen? So I have to examine you, Eric, to let you know what the story is. I'm sorry your medial meniscus was removed. A third of it was removed because that gives you instant arthritis. That gives you instability. That meniscus is a cushion. And I treat people with meniscal tears every single day, lots of them every single day. It's the most common thing I see. And most of them get better. I didn't take out the meniscus. I didn't sew up the meniscus. I just injected the knee with cells, that are healing cells. So it's just a different, I always tell people when they say, well, how come the surgeon told me this and you're telling me the opposite? And I use the analogy of religions. There's different religions, and people that are of one religion don't like the other religion. And that's the way it is in medicine. I think what I do works great, and the surgeons think what they do work great. Who's correct? Well, I don't know. You be the decider. You're the patient. You already had a surgery that failed. So if it were my knee, Eric, I would be injecting it, with regenerative medicine using your platelets or stem cells. But that's just me. I've done it to my knees with great success. And yes, I have meniscal tears in my knee. They're not the problem. They've never been the problem, and I doubt they ever will be a problem. Now, if you have a a flap tear of a meniscus where your knee is locked up and you can't move it at all because the meniscus has bent over, so to speak, and it catches the joint, you may need to have surgery to remove that or have it tucked back down, sewn down. But those are fairly rare, and even though I have patients with flap tears where the surgeon wants to take it out, when I do the examination, there's still range of motion. I tell them that even with the flap tear, they don't necessarily need to have a surgery. It's not the right thing to do. So I need to examine you first, Eric, before I can give you more of a definitive answer. And even with a more definitive answer, there's still no guarantees that what I do is going to work. In medicine, we never know for sure. But it's certainly conservative, and it's certainly not invasive in getting a surgery where you can get infected and have immediate arthritis afterwards. I just see way too many people that come in with a failed surgery, any part of the body. Any other questions, Eric? Those are good questions you brought up.
No. You've been most kind with your time. I appreciate it. No, I've long wanted to see you, so I'll be making an appointment. Thank you.
Yeah, God bless you, man. I hope your knee heals up. I always tell people the best way to heal is to stay away from doctors. It's true. Most things heal on their own. I know that's crazy. Even like I have a very good friend who's got a radiculopathy down her leg. Severe pain for several months. And she called me up and said, what should I do? And I said, well, 94% of those radiculopathies, those leg pains, go away by themselves. And she said, yeah, you know what? It did go away for a while. And so we'll see what happens with her. All right? Eric, God bless you, man. Yeah.
Thanks for your call, Eric. So do you want to give the phone number and I'll give the website? How's that?
I'll actually do it all and save you the hassle.
I should be paying you.
Talk to me live right now on the show. My number, Dr. Marc Darrow here, 866-870-5752, 866-870-5752. Or you can call me at the office. There are people by the phones there in case the lines are busy. The number there is 800-300-9300. And the website is, Nita, do you remember it?
www.lastemcells.com. That's lastemcells.com.
Right. And there's a slot on every page to email me. If you're shy, just email me. I'll answer you and maybe even give you a phone call. I do that a lot with people and find out what's going on with them. So what's the last thing that goes through a bug's mind when it hits a windshield?
Through what? I didn't hear the beginning. What's the last thing that, what?
What's the last thing that goes through a bug's mind when it hits a windshield?
Oh, a bug's mind. Okay, now I heard the question.
It's butt.
I thought I was going to say, bye-bye.
Now, here's one that I don't even understand that someone sent me.
Okay,
let's try it. I'm going to say it. Let's see if you can figure it out. I can't figure this out. What did the janitor say when he jumped out of the closet? Oh, I get it. Supplies. I guess you never would have gotten that one, Nita.
No, probably not.
Do you want one more?
Sure, why not?
All right. Now, I haven't looked at this one yet, so we'll see.
Okay.
Imagine if Americans switched from pounds to kilograms overnight. There would be mass confusion. I don't even get it.
Why would there be?
Imagine if Americans switched from pounds to kilograms overnight. There would be mass confusion.
I don't get it.
I don't either. But someone out there, I hope, is laughing because they got it and we're not smart enough.
I see a call coming in, though. That's pretty good news.
That did it.
Maybe they're calling to explain the joke to us.
I hope so.
So
Okay, Ralph.
okay, let's
I
go
helped
to
his knee
Ralph.
10 years ago. You're doing great. But did you get the joke, Ralph? I didn't get it.
Ralph, are you there?
Yes, I am.
Oh, you're
Ralph,
in Ohio. He's
are
in
you
Ohio.
from Ohio?
This is exciting.
Well, I am. I used to live in Claremont, California
Okay.
for 56 years, and a neighbor of mine who you first did her knee in 2006, and then you did some stem cells, I think about 2 or 3 years ago, on her neck and her knee again.
Okay.
She recommended me to you when I went to you in March of 2012.
Wow.
And you did,
I was just a baby.
in my knee, and it's doing great. And
Wonderful.
I've actually done, with other doctors, I've done 54 what I call sessions.
Yeah.
And I love this stuff. It's great. I recommend it to people all the time.
That's amazing, Ralph. Thank you so much. Yeah, it's been working on my body since around 1997, and it's worked on Nita. It works on most of my patients. We get about 60 to 80 new patients a month, and most of them try this, and most of them are happy, not everybody. And there's reasons for failure on this, Ralph, so people should know that. I'm going to use you for the guinea pig here to explain it. A lot of people don't feel like they heal because they're too active after the injections. So we give them an injection, then they go out and continue their sports. They
I
beat
gave
it up.
skiing, which killed me, but
Yeah. Did you ever go back to skiing?
no.
Okay.
That's not worth it. I'm glad I can walk.
Yeah. Well, I get that. I gave up skiing. I gave up skiing also.
I was very close to getting a knee replacement,
Yeah.
and my neighbor in Claremont saw me limping around the block with my dog and said, "What's the matter?" And we got talking, and she told me she had went to you, and then I backed out of the knee replacement because I was out consulting with a guy and everything, and I never did it. And I'm doing great. I've had limited range of motion, which you told me up front that I probably wouldn't get that back. But
Well, theoretically, Ralph, you
today.
can still get your range of motion back. It would just take more treatments probably than you want to do. So It just depends. The other reasons for failures of regenerative medicine, a lot of people take anti-inflammatory medicines like ibuprofen. There's a whole slew of them. And that blocks the inflammation that's needed to bring fibroblasts to the area that actually grow back the tissue. And then sometimes it's just not enough treatment. People will get a treatment or two and they go, didn't work enough, or it didn't work. Well, it's working. We know from studies that it's growing tissue, but how much tissue do you need to feel better? That's a question that no one has the answer to. And then a lot of people who do this, a lot of doctors don't use an ultrasound, so they're doing blind injections. And I'm going to be honest with you, you cannot do a blind injection into a knee joint, a shoulder joint, a hip joint, places like that, without an ultrasound. You've got to use the ultrasound. And years ago, when us regenerative medicine docs would meet at national meetings, one of the big issues was, why don't hips heal very well? No one had the answer until we got ultrasounds. Then everybody started healing. And the reason was we were putting the solution in the wrong spot because it was done blind without an ultrasound. And then the last real reason is what I'm going to call a bad doc. You get guys who just don't know what they're doing, or you get people who line up lots of patients and hire a doctor for a day who doesn't even know what they're doing to do these injections. And yeah, you'll get a lot of failures with that. I get a lot of people that come in, they say, a nurse injected me or a physician assistant injected me, and they might be great at it. I'm not saying they're not, but most of them are not, and they don't do it every day of their life. And the one thing that I always tell patients when they ask me for a referral for anything, I don't care if it's heart disease, kidney problems, doesn't matter, or even a surgeon, I get asked for referrals. I always say, go to the guy who does the most of this. You always go to the doctor who does the most, not the doctor who does it once in a while. They don't know what they're doing. And it's the same thing with regenerative medicine. Now, luckily, I'm told that I do the most of anybody on the planet. I don't know if it's true, but I sure do a lot. I do it all day, every day, and I am busy. So when you do a lot of things, you get to see a lot of things that most doctors don't get to see and know how to handle it. You get the experience. So Ralph, thank you so much for calling in. I'm glad your knee is still doing well. And again, if you want more range of motion on that knee, you may consider doing more treatments because, theoretically, if you build up enough cartilage in there or enough fibrocartilage or whatever it is that is worn, the meniscus can be worn, the cartilage could be worn, who knows, I don't know unless I examine you. It's possible to actually get more range of motion, okay?
Okay, thank you.
God bless you, Ralph, and thank you, and I'm sorry you moved to Ohio because I don't get to see you anymore.
No, we love Ohio.
Well, that's good. I'm glad you found a place you love.
Thanks for your call, Ralph. Take care. Our number is
866-870-5752. Call me right now. Talk to me. Dr. Marc Darrow. I can tell you how to heal your musculoskeletal pain with simple injections of platelets and stem cells. Again, the phone number is 866-870-5752. If you want to reach me at the office or talk to my staff about issues we didn't cover, the number to the office is 800-300-9300. And the website, which has videos of me doing these injections, is www.lastemcells.com. If you call me now, I'm going to send you a free copy of my book. I even pay the postage. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword was written by the beautiful Suzanne Summers, who knows quite a bit how to heal using natural medicine. Nita, you breathed.
Yeah, once in a while. I do that.
And we also do regenerative medicine on the face. We call it the vampire facelift to regrow the collagen in the face. As we get older, the face dries out just like the ligaments, tendons, and joints do. And that also can be grown back and make you look young and beautiful. And we do just about as many vampire facelifts on males as females. Also, this can be done on the head to re-stimulate hair growth if your hair is thinning. It's not going to work on Dr. Phil. Sorry, Dr. Phil. We don't want you to just have a little fuzz left. And let's see if I have time for one more question. Should I try to get that done here?
Sure.
Okay, this person writes, acute pain from previous surgery. Let's see here. I was referred by one of your patients who had great success. I'm looking into either PRP or stem cell for my left shoulder. Ooh, I've had 2 rotator cuff repairs 14 years ago and 6 years ago. In my non-dominant arm, very active, trained jiu-jitsu 3-4 times a week. Recently had some acute pain in the surgically repaired shoulder. I'm currently treated by a physical therapist to increase shoulder mobility. That's good. It does help with the pain and movement. My hope is to reduce inflammation and pain and repair or promote healing in the event another slight tear. Is this something you can assist with? Hopefully, yes. I have to examine you to tell you. But you've already had 2 failed surgeries, so please stay away from the knife. Okay? I rarely ever find that a patient needs surgery. They come in saying they do. They've had several surgeons tell them they do. But then I do an examination, and I find they really don't need the surgery. There's an issue raised in this question, which was a tear. So I have 3 tears in my right shoulder. One is a supraspinatus tear, which is the most common rotator cuff tear, a subscapularis tear, and I have a labral tear. Do I have any pain in that shoulder? No. I'm lifting my arm up. Okay, I'm flinging it around. I can do whatever I want. I can do sports. I can do push-ups. I can play golf. I could lift weights. I can do whatever I want. Do I have tears? I do. So why do I have tears and not have pain? Because those don't necessarily cause pain. I did have pain, but I injected myself a few times. Over the years, I've had 3 shoulder injuries. Well, it's time, Nita. God bless you, everyone. Thank you, Nita.
You're very welcome. Thank
Alex
you.
and Suzette. God bless you all.
Remember, listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens. We thank you for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.